Brady, and we are, as a country, I think, facing one of the most important weeks in a generation. A week where the House will vote on a plan that Nancy Pelosi has presented, that we will vote on Thursday, that will change the way health care is delivered in America, and I believe change it in a bad way. I want to thank Benny Fogelman for helping organize this event today, all of you who helped get the word out. I'm going to ask our State Representative John Otto, who knows the budget situation in Texas very well and knows what expanding Medicaid could do to your taxes in this budget. But I'll just tell you, this is the bill, nearly 2,000 pages long. It's twice the size of that monstrosity we were talking about all August. 2,000 pages, $1 trillion of new spending for starters, and it will interject government into our most intimate health care decisions. It will increase taxes, especially on small businesses. It cuts Medicare nearly $500 billion for our hospitals, our home health care, small businesses, our hospices, and in Texas, we have 1 million seniors who choose Medicare Advantage. That's the plan of choice, especially in rural areas. That gets slashed, nearly eliminated in this bill. It will run deficits into the future that we can never hope to afford. And in fact, if you read that this is budget neutral, doesn't cost a dime, let me tell you that they've used every budget gimmick you've ever dreamed of, including, since that last bill, they took a provision, $250 billion, let me say that again, $250 billion to reimburse doctors, and they took it out of this bill and they just set it over here and said, you know, that money doesn't count anymore. Now they have no way to fund this, not a dime to do that, but they just said, well, now we've lowered the cost, even though this is going forward. So this bill is going to run deficit trillions of dollars in the future, on top of Medicare, which we can't already afford, Social Security, which is going bankrupt in about 6.5 years as well, on top of the VA and military health care, which we don't fund adequately as it is today. There are a lot of secret provisions in this bill we're digging out. One of them that is in there would close down 40 hospitals in Texas. These are doctor-owned or doctor-invested hospitals. They don't like them in Washington, so they picked January 1st, last January 1st, and said if you're not up operating with the Medicare number, you're out of business. That will not only shut down 40 hospitals in Texas, but cost us about 15,000 jobs. So if the goal of this bill is to improve health care access, in Texas they're going exactly the wrong direction. There are mandates on small businesses to offer health care or pay an 8% tax. There's mandates on individuals to buy the health care that's offered or pay a 2.5% tax. There are taxes on medical devices. We call them wheelchair taxes because seniors will end up paying those bills. $800 billion of taxes in this bill, one of the largest tax increases in American history. And again, all of this is the first step toward a single-payer national health care system. And that is what this bill is about. And what's interesting is that from here to here, this bill is going to use $1 trillion to cover 21 million more Americans. That's about $50,000 a person. And yet at the end of the day, 18 million people will not be covered. So they're going to spend $1 trillion to get part of the way there on coverage. It has, you search through this bill, it has no lawsuit reform at all. It has no reduction in all the bureaucracy in healthcare. In fact, it adds 31 more federal agencies. That was this bill. We're still counting up the new commissions and agencies in this thing. So all the things you want to do to make healthcare more affordable, including competition and choice, and pulling back the curtain of mystery on medical pricing, you can't find it in this bill at all. So I'm here today to tell you this bill is bad for Polk County. It is bad for patients, for small businesses, and it's certainly bad for the taxpayers. I know too, and I'm devoting every waking hour these days to killing this bill. This vote is Thursday. They're rushing it to the floor. We've been on telephone calls, conference calls, meetings throughout East and Southeast Texas here the last 24 hours, urging people to act now, to engage now, because this is going to change the future and it's going to change it the wrong way. State Representative John Otto is here, and he played such a key role to help bring the land, make it available for the new college conference center for the county. And I wanted to ask John to give his comments. The way they cover people in this bill, the new $21 million, is basically they raise Medicaid to cover half of them, and then they create a new public option and government-run plan to cover the rest of them. That Medicaid expansion, while in the first years will be covered by the feds, in the follow-on years, not so much. And John's had to deal with unfunded mandates before. State Representative Otto, could you step forward and give us your thoughts?
Thank you, Congressman Brady. I want to thank Congressman Brady for, traveling around his congressional district and bringing this to people's attention. This is vital. We need to be contacting all of our Texas delegation about how bad this bill is. He's exactly right. This is nothing more than an unfunded mandate back to the state of Texas on the Medicaid coverage. That's one of the fastest growing parts of our budget currently, and all this bill is going to do is speed that growth up. So it's going to create a budget crisis in every state if this bill passes. What they need to be looking at is, just as he said, Texas in 2003 passed tort reform. We have now had specialists, doctors from other states coming to this state. We now have OB/GYN clinics back in the valley in South Texas where we had none prior to the passage of tort reform in 2003. So those are the ways things need to be addressed. We do not need this huge unfunded mandate passed down to the states. And I want to thank him for having this press conference and bringing this to everyone's attention, and we do need to act.
Great, thanks, John. I will tell you that those lawsuit reforms that you and others brought to the state of Texas has had a huge impact, not just on the premiums, but on bringing doctors, and not just to Houston, Dallas, to rural areas, to the valley. It's really been tremendous, so thank you for that. I would challenge you, if you want to go through here, you can read how many times the word tax is used, how many hundreds times the word require is used, and shall and must, except in one instance. In the bill, it has, when it talks about members of Congress enrolling in the new government-run plan, it says may. Members of Congress may enroll in it. Now, they tell all the rest of you what you have to do, but members of Congress are exempted from having to be part of the public option. That ought to tell you anything you need to know about this bill. With that, why don't we stop, take some comments or questions? Any thoughts? Yes, sir.
Let's talk about this bill and the funding for the first year.
Yeah.
How many people remember a 3-cent stamp at the U.S. Post Office?
Yeah.
And what is it now, 44 cents?
Yeah.
Multiply your trillion times, what, 12, 13 times?
Medicare turned out to be 10 times more expensive than their wildest guess, and my thought is this probably will be too.
And if you think that the government-run health care is going to work, go to Houston, spend the day at the Veterans Hospital down there. I mean, that is, I went down the other morning, had to have blood work. And you take a ticket, just like you used to at the butcher shop. My ticket was $131. And this was like 8:30 in the morning. I sat there until past 10 o'clock, and they got your numbers up on the board there, and they were doing 25, 26, and 27. Took them an hour and 15 minutes to take blood for 3 people, and I'm sitting there over 100 numbers away, and I got up and walked out. You know, 45 minutes for 3, simple ciphering, you're not gonna make it today.
Well, it's interesting you say that, but that's already happening. We already do rationing within the VA system.
Oh, it's-
That we do it
it's
actually
horrendous.
within Medicare. You'll see it within the rest of the system because the government's going to run out of money.
Yeah, well, I had a stress test down there the 2nd day of September, and I'm waiting for the results of it. And a cardiac stress test. Evidently, I'm all right, I'm still alive, but, you know, you would think that if you go in for a stress test on your heart, someone's gonna let you know something. From 2nd September to today's, what, 29th, 30th October?
That would build a little stress right there, I think.
Well, that'd give you a heart attack. Right
No
there,
kidding.
wouldn't it?
It gives me one
But,
thinking about it.
and then they talk about Medicare for everybody. You got it right there.
I don't think the American public's fooled by this. We had Frank Luntz, if you've ever seen
Yeah.
him on TV, he did a recent poll where he asked a number of people across the country, Republicans and Democrats, which of these two statements are the most true? The government's going to spend $1 trillion of your tax dollars to reform health care, and it won't add a dime to the deficit. Or there is human life on other planets. By a 3-to-1 margin, they chose there is human life on other planets. Because people know this is going to cost us so much, both in the short and the long run. So, again, I don't mean to keep your time. You all have busy lives. It is Halloween, but this is something, if you really care about your country in the future. Benny, your thoughts?
Yes, Congressman, thank you for what you're doing, and let me ask you, we already know where you stand. What can we do to be effective to try to persuade other congressmen and senators to vote this down?
You know, I think in Texas, in the country, all Republicans are voting no on this bill. We all support health care reform. We don't support this health care reform. And that goes for Texas as well. In Texas, not all of the Democratic delegation has signaled their support. There are 3 who are either undecided or have not yet agreed to support the Pelosi plan. And I think people in that district and friends and families and others, co-workers, Chamber of Commerce people, county judges in those districts need to weigh in with their member of Congress. And so that's what I would do. And the 3 who are reported by the press to be yet undecided are Chet Edwards, it's out of Waco, but represents Central Texas from College Station up to Cleburne. Cyril Rodriguez, who is out of San Antonio but represents a lot of West Texas and the border, Del Rio, Fort Stockton, all throughout that area. And then Solomon Ortiz, who lives in Corpus Christi. His district goes to Brownsville. Those 3 members of the delegation are, by press accounts and most knowledgeable accounts, have not yet said that they would support this new bill. So I would go to where the undecided members are. And I'll tell you this, I think this bill can be beat. I know the Speaker has a huge majority, but she can only lose 38 members of her delegation. There are 36 Blue Dog Democrats who are arguing about the cost of this and the impact of this on our deficits. And there are 40 pro-life Democrats who strongly object to the ability in this bill to use taxpayer funding for abortions. And wherever you are on that issue, pro-life, pro-choice, wherever you are, there is great consensus. I think 3/4 of Americans say you shouldn't use tax dollars to fund those procedures. I mean, there is, but they do for the first time open that door in a big way here. So because of those dynamics, again, she has a huge margin, but I think if people speak out, we have a chance. It's going to be a tight vote, Benny. I think it's going to be a very, very tight vote. And I think we have a chance to stop it.
Congressman, I find it particularly stressful that I'm hearing on the news that this administration, the Obama administration, their spending ideas are astronomical. And I think it stresses a lot of Americans. Could you hit on that briefly?
Yeah, it really is. I really think a lot of the town halls in August weren't just about health care. They were about spending, the deficit, cap and trade, just a whole number of issues. And if you're in your family, in your business, you could not go in debt so deeply, so quickly, and ever hope to survive. And today, you know, when you get lectured on your finances by China and France, when you have world leaders actually talking about using a different currency as the reserve currency, as the safety currency in the country, when you have people fleeing toward other commodities and away from the dollar, it ought to send up a lot of red flags. And it's all because of the deficit. They don't believe we will be serious about getting back to a balanced budget. They just don't believe it. And they watch the signals from Washington in the White House, and it reinforces it. I'll finish with this. I'm a lead Republican on the Joint Economic Committee, so we follow the economy very closely. You heard about the 3.5% growth last quarter, although if you look at it, most of it was just one-time things, cash for clunkers. We had a bump from home buyers, credit, and businesses finally drew down all the inventories they sort of had set aside. All those are one-time instances. If you look at investment, what you see is most of the business community, large and small business owners, are delaying their decisions to invest because of Washington. They don't know what politicians are going to do on health care to raise costs, on energy to raise costs, on income and capital, and they're convinced that at the end of the day they're going to have to raise taxes to pay off all this spending. You know, and the dollar won't be in a strong position. So I'm convinced the government is actually hindering our economic recovery because of the spending and because of their uncertainty. It is hard enough for business to predict, as Sydney knows, it's hard enough for a business to predict the marketplace. Trying to predict that in Washington at the same time is freezing. So, Sydney?
Well, that actually leads right into what my question is going to be. In our area, I would say our major concern would be small businesses.
Yeah.
You know, more of your mom and pops,
Yeah.
family businesses. I mean, let's face it, Polk County is not full of huge industrialists. So my concern would be for those businesses. So what is the impact going to be on the small business?
Significant. And here's why. The way it's structured, if you have about 17 workers, roughly payroll of $500,000 or more, you're triggered into all of this. The mandate to provide health care, not just for your full-time, but for your part-time workers as well. And not just provide health care, provide government-approved health care. And you have to pay 72.5% of your workers' share for them, 65% of their family, or you have to pay that 8% payroll tax. So for small businesses, they're going to see some mandates they've never seen before. Also, there'll be incentives. I think that those taxes and mandates will be an incentive for small businesses to drop their health care, to just push people into the government-run plan. It's easier to pay that tax than to try to pay and comply with all those mandates, especially, and it's not just small businesses, larger businesses with a lot of part-time employees are going to find themselves in the exact same boat. When they weigh it out, it will be easier to dump their health care plan. I don't think that's good for anybody. And the second impact is that they pay for this in the House with a tax they call a millionaire's tax, income tax on people making more than $500,000. Half of those taxpayers in those brackets are small businesses who file as individuals. And so you're going to actually increase taxes to 45% on the job creators, the main job creators in this country. So the mandates and the increases will have a big impact on your chamber members.
And
I'm sorry, Congressman Brady, we've got to keep you on schedule.
Okay, great.
thank you very much.
Great. Well, if you've got questions about the bill, contact our office. Brandon Reese does a great job as our field representative, and you yell up Brandon, we'll get the answers for you.